Now, let's move on to a big development in the recovery from the COVID-19 pandemic. The FDA officially approving the Pfizer vaccine for children ages 5 to 11, and the CDC following suit and giving its blessing. That opens the door for tens of millions more Americans to get vaccinated, something that should ease parents' fears and theoretically cut down on transmission. Michael, how important was this step in the wider front against COVID-19?
Well, it's an important thing for New Mexico, specifically, as well as the nation. And of course, New Mexico has about 6% of New Mexico cases have been with children aged 5 to 11. And unfortunately, and we've had 300 children in New Mexico who've been hospitalized for COVID. And unfortunately, 5 have passed away. I think it's an important step for us. Our children are extremely important to all of us here in New Mexico, and we need to do everything we can to protect them.
Inez, of course, New Mexico is near the top of the country in terms of vaccination rates, but will people be a little more hesitant to vaccinate their kids? It's just a little bit different when it comes to children versus themselves, I got to think, for some people.
I think that's right. I have friends who actually are posting on Facebook right now with smiley faces saying we're scheduled this weekend. They have been waiting, they are thrilled, and they want their children vaccinated. What worries me is that, again, if you don't get close to 100%, it doesn't have the protective quality that we need. And we go back to the unvaccinated versus the vaccinated.
Right.
And I totally understand a parent might be a little more reluctant with a young person because you're worried about long-term effects. But I also believe if we protect each other with vaccinations, we're going to be done with this and on to whatever's next in our crisis of the year. It seems like that we're living through now.
Dan, we've had a share of masks, protests, that's for sure. But now we've got kids potentially vaccinated. Does that reboot the mask or rejigger the mask conversation in some way? Will parents be feeling like, well, you know what, I took that step to get my kid vaccinated. Why do they still need to wear a mask? Is some of that potentially a problem?
Yeah, so I think there's a lot in that question, Gene, that you asked. First of all, I think it doesn't matter where you stand on an issue. People seem to rally around their kids, right? I mean, at the end of the day, you can say, I believe this about vaccinations, you believe that about, but when we start lumping kids into it, people seem to get a little less tolerant of having long conversations. I think, yes, we're going to have these conversations, and we're going to have these conversations for multiple reasons. One is, as I've said before, look, I feel bad having to give the disclaimer. I had COVID and I'm vaccinated. My wife is vaccinated. I'm not an anti-vaxxer. But I got to tell you, the way this has been handled with information and disinformation from all sides is leading people to just throw their hands in the air. And now you start to say, okay, we're going to go down and we're going to make this happen to kids. I was watching the other day when the FDA made the decision to roll this out for kids, and people are just not, they're not cognizant of what they're doing, right? There's a doctor who literally on the Zoom meeting when they voted said, listen, we're not going to know the long-term effects on the kids until the kids get the vaccine. So I'm voting in order for the kids to get the vaccine, which makes you go, hold on a second, wait a second. So you're saying my kid should be a test monkey, that my kid should be a petri dish? And so I think that you couple that with what we're seeing now with adults, right? We've all been pushed to get vaccinated. We kept hearing these numbers. The numbers keep moving from you got to get this percentage, this percentage, this percentage. We all have gotten these people. I mean, New Mexico's leading in the number of percentages, but we're still wearing masks. We're still doing things that people I hear all the time saying, well, why did I get the vaccine? If I went and got the vaccine, and the other thing we got to remember too, these are not immunizations, they're vaccines.
That's right.
They don't keep you from getting sick. They just limit how bad you're going to be sick. And so there's a difference between having a conversation about what's the risk I'm going to take for my child to immunize them against polio versus what's the risk I'm going to take against my kid getting sick with COVID. And on top of that, the numbers. I agree with Michael. We all want to protect our kids, but I think a lot of people are weighing the unknown versus the known. The unknown being what's the long-term effects of vaccinations. The known being, listen, kids seem to be carriers, but overwhelmingly they don't really get sick from it, not nearly as bad as adults do. So why are you taking the risk? I think they got to do a better job of rolling out the benefits of getting kids done. And I think in regard, it's a bad thing to say, but there's got to be a trade-off, right? I think the state needs to come out and say, if we can get to this number of vaccinated kids, we're going back to school full time. This number,
Gotcha.
we're not
Yeah.
wearing masks anymore. I think there's, kind of like they did they found out how to get adults vaccinated, right? Give them $100. People will do just about anything for $100. They got to find a way to get kids in the program.
Michael, Dan is literally begging this question. Michael, have we learned something about the first go around about how to do this? And there's anything in the rollout should be changed, adapted, implemented when it comes to kids? Do we have to change the messaging here?
Well, I guess for me, I mean, it's an imperfect world, and we're dealing with something that we've never dealt with, a major, issue that we've never dealt with before. And I guess I would say, based on my understanding, had we done some things early on, and not pointing fingers at any administration, but had we done some appropriate and timely interventions earlier on, we in fact would not be at this place in time. We would have had better outcomes. But once you muddle the water, then it's really very difficult to, I mean, there are all of these variables now. There's this there's the divisions about my rights versus community responsibility,
Right.
and responsibility to your elders and your children. I mean, there's all these things that have come into play that have totally muddled the field. And so I think in hindsight, we will look back and we will have learned many lessons, but we're learning as we go along. Again, we've not dealt with anything of this nature for quite some time. The other thing is we better learn some things, because this is not the end of it.
That's a good point. Inez, I can't help as a parent. My kids are older than this 5 to 11 cohort we're talking about, but you know how kids are. Some kids are vaccinated, some kids are not. There's intimidation in the classroom, on the playground. They bring their parents, in the door with them. Are we asking a lot of kids here when we ask them to be vaccinated? Is there extra stuff here?
I don't think so. I mean,
Good.
you're
I
asking
hope.
a child to not get as sick as he otherwise could, and to perhaps not carry it to his elder grandmother. I believe that when Dan raises the point, why did I get vaccinated? Well, you got vaccinated, so perhaps we wouldn't have a variant that proved so strong that we had to go back to being masked.
That's right.
If people had jumped on the cure, we got a basic cure in terms of death. If they had moved ahead, gotten vaccinated, we wouldn't be in this place either. And as much as I believe that people have a right to medical choices, I also believe that I have a right not to be infected by your medical choice. And I have people in my family, as we all do, with underlying conditions.
Yep.
And I can't risk, my 82-year-old mother-in-law being around unvaccinated people. I can't risk my kid with asthma or my other relatives with diabetes being out there, even though they're vaccinated, because they cannot get sick.
And that's the $1 million
Gotta go,
question.
Dan. Gotta go, Dan. My fault there. Thanks to our line panelists for their input this week. And we should add, if you haven't gotten your vaccine yet on our topic, go to the state health department's website to find a shot near you.